You deserve the best.
Welcome to CAClive. Tom DiCamillo, Joe Carrero, back after a 2-week holiday hiatus. And what was that, Frank the Godfather? What was
Frank
that?
the Godfather, yeah, absolutely.
Is that who it is, or is that a
sandwich? One of his signature sandwiches. He's the owner.
That's pretty awesome.
Right out of Italy.
It could be a little scary going there.
Yeah, right.
But you said the food's really good.
You got to walk through that metal detector, and then you get frisked, but you get a cigar.
But you know what? It might remind me of back home a little bit.
Right.
I always told you. I said my grandmother there's an Italian family, and she's got 100 offspring. I mean, when you get down to the great grandchildren, she's 90. The youngest one was just born. She's got about 100 of them. So it would remind me of home. So
you still doing enforcement out here in this area for them, or no?
I'm the West Coast enforcement.
Gotcha.
Yeah, that works really well. Tom DiCamillo, Joe Carrero, we're live in the studios of KQCK in the Santan Valley, and we appreciate everyone tuning in, as always, on Thursday mornings from 9:30 to 10:30. This time of the year, Mountain Standard Time. CAClive brings you the best of Central Arizona College, and today we have some special guests. We're going to talk about sonography, and I'll have to admit, I'm not versed in sonography, but it's fascinating because not many community colleges have some of the medical technology programs that CAC has. And joining us is Dion Winter, who is the new program director. Dion, welcome to CAClive.
Thank you, Tom.
And then also Sam Reed is a student that graduated not just from sonography, but also Frank Malika's program, the X-ray tech, the radiology technology program. Sam, welcome. We appreciate you coming in.
Yeah, thanks for having me.
We're going to have Frank on at the end of the month. Is going to come on to talk about the rad tech program, which has been a tremendous program at CAC. And I guess maybe community colleges do have a lot of these programs around the country, but I don't think a lot of people really realize it, do they, Dion, that some of these type of programs that you can get a degree and get a really good paying job and doing something that you like and get really practical experience.
Yes, that's true, Tom.
Let's talk a little bit about the diagnostic medical sonography program. What does that mean? If I say diagnostic medical sonography and people are listening, explain that to them.
Actually, diagnostic medical sonography is the practice of using sound waves to take images and pictures for diagnostic purposes.
So if you say, is that different than an ultrasound? Or is it the same thing?
No, it's just semantics.
Just
Ultrasound
semantics, okay. So if somebody's if you're going to get a medical procedure, you're going into, what would you use sonography for? I mean, ultrasound, I always think of women that are pregnant, but it's probably a lot more than that.
Absolutely, it's a lot more than that. We use sonography for a large number of things for both men and women for diagnostic purposes. We use it for liver, gallbladder, kidneys, lots of blood vessel studies in the carotids, the venous studies. We use ultrasound for obviously pregnant women, for non-pregnant women, thyroids, all different kinds of studies.
What's a venous study?
A venous study is a study that's often done in hospitals to rule out blood clots, which is a very serious medical condition.
When you're using this kind of technology, I guess the question would be over the years, when did this technology really come to the forefront? Because you hear the terminology of ultrasound sonography, you hear that terminology thrown around a lot, but when did it really sort of become prominent in the medical field to be so commonplace?
Actually, when I started training in ultrasound in about 1977, probably those first 2 years, right about 1980, it really took off because physicians started using the diagnosis just from sonography to go straight to surgery without x-ray or anything else. We were able to see gallstones and diagnose gallbladder disease, a lot of common diseases. We also did a lot of OB ultrasound, and it just took off from there. One of the biggest things that changed sonography was computers.
Just because of the speed that they could operate at, or just the versatility of being able to do more? Why did computers change it?
Absolutely, the speed. The old style was analog, which gave you that weather map look that people talk about, where you just have a black and white image. But with computers, you can use transducers, which is the instrument, the probe that you place on the patient that makes the sound waves. That makes it so that you can get it megaseconds faster.
Before sonography and this technology, was everything pretty much X-ray?
Mostly X-ray. CT was just barely coming on the scene at the same time that ultrasound was getting popular, and it was computers that drove that too.
Before this, the technology is so far advanced, obviously, over the last 30 or 40 years. But back at that time, if somebody had a medical condition and they really couldn't tell, was it more sort of this invasive, where you had to go in and look for, like a doctor would have to go in and do surgery to really kind of see what was there, as opposed to now, did the technology change with sonography and ultrasound where it eliminates some of that?
Actually, sonography did eliminate a lot of what they called exploratory surgery. There's almost no such thing anymore.
That's always a scary term, exploratory surgery. So do they use a lot of this technology in athletes when they're looking at like injuries, knee injuries, shoulder injuries, those kind of things?
Actually, that is one of the biggest up-and-coming fields in sonography. It's called musculoskeletal sonography. And there's newly people being registered in that field as a specialty. It's growing in sports medicine.
So you look at, like, you see somebody like Adrian Peterson, who plays for the Minnesota Vikings, that tore his ACL completely last year and came back and almost set a record in rushing, which 10 years ago, an athlete, or 15 years ago, they'd be done. They're an athlete. So does sonography help diagnosis with injuries? Are doctors able to make a better diagnosis now using this technology, as opposed to kind of waiting to see what will happen?
Actually, it's like any other thing. Early detection and early diagnosis is always the key.
Okay. So let's talk about the program at Central Arizona College. How long have you been on board at CAC?
I started this fall in August. So
you're a newbie on the block.
Absolutely.
And then you got the new campus to play with up there at the Superstition Mountain campus. Talk about the sonography program at CAC, what it is, what students will learn, and how they can get involved.
Well, at Superstition Mountain campus, they have a full general sonography program. We offer a full abdomen, OB, and an introduction to vascular sonography. Students have that are in the healthcare profession, either radiologic technologists, respiratory therapists, nursing students are all qualified for the program. It's not an entry-level program. It's a program for healthcare professionals.
So they're already working in the field or have a degree. And like Sam, I'm going to bring Sam in here real quick. Sam, you went through the radiology technology program with Frank Malika and then came back and went through the sonography program. Was that something you'd always had planned to do, or once CAC got this program, you thought, this is something I could just continue the growth in my field?
Mm-hmm. Well, for me, I went through X-ray school thinking, I want to be an X-ray tech, and that's what I want to do. And while I was in X-ray school, we're at many different hospital sites around the valley, and I saw, while in my X-ray training, I saw different things going on, like ultrasound. I saw a little bit of nuclear medicine, a little bit of radiation therapy. I was exposed to all of those things, and when I saw ultrasound, it just kind of caught my eye, and I kind of kept it in my mind for the whole time, and it was kind of working in me, and I was just little by little, I kind of geared towards that that way. Like, I want to do that one day.
Is it a type of field that there's so much as you go through the radiology technology program, you get out in the working world, and it says you are exposed to these things, that there's so much that you really don't know what you like until you kind of get and start seeing these different things? Is that kind of how it works?
Yeah, like, it's kind of like when I first got into college, I didn't know how many opportunities there are out there until I actually got into it and saw how many options there are. Because when I first got into college, I didn't even realize I wanted to go to x-ray school, But then I saw somebody, one of my friends that went to it, and I was like, well, okay, I can do that, That sounds cool. So once you're in the realm of it exposes you to new contact people and new ideas, So that's it's the same in lots of different fields.
I want to talk a little bit more about your experience at CAC. We got a phone call from the audience, Joe.
Josh from Phoenix says, welcome back, first of all. And I don't think he completely grasps what this is. He wants to know, are we talking about where the person types and transcribes medical stuff? That's not correct, right?
It's medical transcription is what that would be.
This is stenography? Is that what this is called?
Oftentimes people confuse the word sonography with stenography.
Oh, sonography.
Yes,
Gotcha.
sono is the word. It's S-O-N-O, sonography.
Kind of like sonar.
And that's probably one of the basic reasons why the profession and the registry has changed it to the simple initials DMS, which is Diagnostic Medical Sonography, so that confusion is a little bit cleared up.
CAC does have a program, a medical transcription program, and they do have a health careers program, has a variety. But this program is obviously different. And Sam, talk about, you said you decided to go into the radiology technology program because you had knew somebody that went through it. And when you started going through that program, what appealed to you? I mean, there must have been something that said, you initially think, oh, this is cool. But when you get into it, do you kind of feel like you're helping people? You feel like you can make a difference?
Yeah, it's a one-on-one contact with patients where to be honest, I never really wanted to be a nurse because nurses are with the patient basically like 24/7. And I didn't want quite that much time with the patient. So with x-ray and ultrasound, you get to know the patient, you get to help them, and then they move on to their care in their room somewhere else. So it's not. So I can do my study and I can learn and I can help them in so many different ways. But after that's done, they can go there to their room and so it's kind of less stressful for me because I don't have to manage this patient all day long for as long as they're in the hospital, which would be kind of a high stress thing for me.
Right now, are you doing radiology or sonography, or are you doing both?
Right. So I recently graduated from the first class of the sonography program from CAC. Throughout the whole time of the sonography program, I worked part-time at an urgent care doing x-ray. Right now, I have gotten a part-time job doing ultrasound while keeping my part-time x-ray job too.
So just building your career portfolio as you kind of move up. What would be the next step for you? Is there something else you'd like to continue on to? Do you go for a 4-year degree? Is there other kind of programs that you can add to your sort of repertoire of what you're learning?
The beauty of sonography with ultrasound is that you can go, there's so many different categories that you can specialize in. You can do OBGYN, which just deals with babies, or you can do vascular, where people get their, you've heard of varicose veins, things like that. There's clinics that treat that, and you can be the ultrasound tech for that. That's one field right there. Or you could do muscular skeletal, which was mentioned earlier. So there's a whole bunch of different fields that you can specialize in if you don't want to just do the general. If you work at a hospital, you're probably going to do just the general stuff, and if you like that, then that's great.
So are there a lot of different jobs, different type of working environments that the students that graduate from CAC can go to? Because you hear Sensei works at urgent care, but obviously you can work in a hospital. Do you do it in doctor's offices? You can work for sports teams. There must be unlimited areas with this field growing.
Oh yes, absolutely. There's you can work in clinics that are actually very fast-paced clinics where they do pretty much a very heavy schedule of patients back to back every day. It's lively and fun. And then there's working in the hospitals, which is demanding, can be also very fun. But and then there's working for some technologists work for mobile companies. There's also technologists that work for travel companies where they go for assignments all around the United States. The license that ultrasound techs earn is a national license. You can work in any state.
How do you decide whether it's going to be an ultrasound, or how does a doctor, whoever, decide if it's going to be an ultrasound or using sonography technology or an X-ray? Like, what would be the difference between the two? Why would you go one compared to another?
So that's a protocol that physicians know as to what is appropriate, the appropriate test for which diagnosis they're seeking.
So Sam's nodding his head. You've done both. What would you be looking for? What would you use? Give me an example of something you would go an X-ray for that you wouldn't necessarily go sonography, and then the other way around.
Right. So if somebody comes in the ER with leg pain, the doctor's not likely going to do an X-ray if there hasn't been any trauma involved. A lot of it has to do, they have a protocol. Okay, this patient, let's say they've been on a plane flight for 6 hours, and they have left leg pain now. So the doctor's going to think, okay, well maybe they have a blood clot. Let's check it out. And so they're going to automatically want to order an ultrasound. That may be the very first thing they even order. The patient, lots of times, is still in the lobby waiting to be checked in. They've just checked in with their basic complaints and concerns, and the doctor automatically says, okay, with these symptoms, I'm going to want an ultrasound so that I can see exactly what's going on.
And what would you use if somebody thinks they have a broken leg or hand or something? Would that be something you go X-ray first, typically?
Yeah, probably X-ray, and then a lot of it has to do with the doctor's protocols and what other study they think's necessary.
Okay.
So I wonder, I just had some X-rays done a couple of months ago on my wrist. Got a really bad wrist problem. Does this take care of tendons and ligaments and all that stuff inside, or what is it? What do you see when you look at it?
I guess the question is, what would you look for? Joe injured his hand, his
Right.
dog ran into him, and it bent it back, right?
Ran it forward, yeah.
Bent it forward. Would it be more sonography or more of a, or depend on what the doctor would think when he describes the pain?
Actually, that's a diagnostic question that
So I had
you probably
X-rays done,
ask
and
a
there was-
physician.
Gotcha.
But either technology could be used depending on what the doctor ordered.
Exactly.
At that.
Well, we just had a barrage of calls come in, and they're still lighting up here. So, guys, if you're calling, just let it ring, and I'll once I get these questions, I'll jump back on there.
If you haven't seen, Joe's got his new headset on, and he's
Not bad, huh?
No, not at all. So go ahead.
All right, Brenda from Queen Creek. 3 local calls in a row. What do you think of that?
Sounds good.
I am a CNR currently. Is there a program to transition into sonography? I don't know what the CNR means, but
CNR is a certified
Is there-
nurse.
I should have asked. I don't know what that is.
Normally,
not sure what that
I'm
is.
familiar with a CNA. CNR,
That's what I'm thinking.
Don't know.
What,
So anyway,
Well, I think the best thing would probably be if they're interested in sonography that they could contact you, come in and talk. That would be the best thing. Why don't you give out your contact information if people want to get a hold of you?
Sure, you can contact me either by email at Dionne, DIONNE .winter, WINTER, at centralaz.edu, or my office phone is area code 480-677-7716.
sorry about that, Brenda. I should ask what the CNR is, but definitely. And is there a website they can go to and get more information?
Yes, if you go to the Central Arizona website, you go to academics and programs, and it's under diagnostic medical sonography.
Awesome.
And if you want to, Dionne is DIONNE .winter at centralaz.edu. And it was with Brenda from Queen Creek.
Yes.
Brenda, we appreciate you listening. If not, you can always also go by the campuses. The Santan Center is located here in Queen Creek area, but this program, sonography, is up at the Superstition Mountain campus up in Apache Junction. If you haven't been up there, the campus has been reopened and it's beautiful. So go ahead, take a ride up there as well.
Rob from Santan Valley wants to know, do you have any plans on offering it at the Santan Center?
Right, when the campus opens up, because of the type of program that is, you have to have
A lot of machines and
yeah,
stuff.
equipment. So for right now we are deciding what programs are going to go into the new campus. So we're still deciding that. However, it's an easy ride up Ironwood to up in Apache Junction. It's not far if you're in the Santan Valley at all. So I would check it out. And if you're interested, it's a great program. Plus, it's close to the valley where there's a lot of jobs up in that way too. So.
And then Janice Earnhardt from Mesa would like to know, what is the industry standard starting pay in this field, maybe low to high, just a general?
I believe that the last I looked on the general...
No one's going to hold you to it.
Yeah, I was going
hold you to it.
Yeah, I was going to say, the last I looked on the general Job Outlook website, if you look at our website at Central Arizona, they have a link to this, so it could be updated. The last update I saw was in March of 2012, and the medium income was around $32 an hour.
Not too
A
shabby,
little
eh?
bit higher in the Arizona area, in the greater Phoenix area.
It's one of those things that probably, and Sam probably could test this, it probably depends on where you're working too. I'm sure there's the more stress and the more responsibility, the type of work. I'm sure there's trauma situations where this stuff is needed. You have to be quick and accurate. It may pay more. So if you're interested in the program, make sure you get a hold of Dion, DIONNE.winter@centralaz.edu. We appreciate all your calls. Joe, give out the number again.
Just hit the mute there, 480-745-1033. And I'm going to turn the chat on as well, so if you want to jump on the chat, of course, you just go to CAClive.com and just hit the live chat, and you can jump on there and ask any questions if you're not able to get through on the phone.
Sam, when you were deciding, as you were going through the program and you really kind of liked this, how did you decide where you wanted to work, or have you decided where you want to work, or as you're looking kind of at the different opportunities? Mm-hmm. Are there places you kind of indicated that, would a high stress situation be good at an emergency room, or would you like to work with kids or something like that? Is that something you kind of are deciding right now?
Right, like that's a real personal thing. Where what would you like to do? A 9-to-5 job at a clinic, or varying hours and days at a hospital type situation? For me, starting out with X-ray, I chose a clinic, but right now, to be completely honest with the job market right now, at least from what I've been seeing now that I'm a graduate, is that the X-ray market and the ultrasound market there's a lot of newly grads out there looking for jobs, and there's not a whole lot of jobs. Lots of hospitals are kind of downsizing, using less people to do more work to save money with healthcare costs and everything. So I'm finding it very difficult. I want to ideally start out in a hospital situation where I'm exposed to so many different types of cases and different interesting atmosphere, but it's kind of tricky right now with the job market for ultrasound techs and X-ray techs to kind of pick and choose. You kind of have to take what you can get for now, in my opinion.
Is the program at CAC, do the students get a lot of hands-on experience?
Definitely. The students get a lot of hands-on experience. They learn both in the lab that's on-site at Superstition Mountain campus for basically normal and instructive study. But most importantly, their clinical rotations begin as soon as they begin in the program and go throughout the entire 2-year.
So they're indoctrinated pretty quick. They're getting started pretty quick. Sam, was that a little bit of a... Did you expect that going into the program?
Not exactly, because with the X-ray, for me, the X-ray was a little more laid back. Mm-hmm. The ultrasound, you hit the ground running, and you are just bombarded with... You need to learn a lot about the anatomy of the body and how it works Where with an x-ray, you learn the bones, and you do learn the anatomy, but you don't necessarily have to know the names of stuff so well. You just need to know the bones you're working with. Where ultrasound, you need to know what to look for. If something's going wrong here, then sometimes over on the left side of your body, something else will be going on, and you need to know that you need to look somewhere else with certain types of cases.
We got another caller, Joe.
Phones are ringing like crazy right this minute. All right, let's start with the first one here. There goes my page.
This is good stuff. We got a lot of people that are interested in the program.
Rory from Muirville, Maine. Moving to the West Coast sometime soon, looking to expand his career. I'm an x-ray tech currently. Is this something that I can get certified in to open up my options, or is this a total career change for him? The small clinic he's in doesn't even have this technology, he said.
I think Sam, you could probably attest to that because exactly what you did is X-ray tech and then went on to expand your options.
Mm-hmm. Like right now, for example, I work for a mobile business where they go to assisted living homes for the elderly, where a doctor has come to their home and seen them, and then the business I work for will go in and do an X-ray or ultrasound, whatever's needed. So I am actually hired as an X-ray tech and an ultrasound tech. So whatever they need, I'll be the one to go and do it. And also in the smaller towns, like for example, up in Globe, Arizona, it's a smaller town, and their whole imaging part of the hospital is just one hallway. And so some of like an X-ray tech will be doing a CAT scan the next minute, and then an hour from now we'll be doing an ultrasound, because they're lots of times multi-talented and certified, and it works out great in lots of atmospheres like that.
So, Dion, for CAC students, for somebody like Sam and the ones that are coming back it's really about making yourself marketable. If you like the field, it's really making yourself marketable and versatile to get these jobs.
That's true. Actually, we highly encourage the X-ray students to go into ultrasound. It's a modality that's very similar to, because it's in the imaging department. Some of the other healthcare professions are familiar, and they will learn imaging when they are in the ultrasound program. But the X-ray techs, it's a pretty smooth transition. I personally am an X-ray tech. I graduated from X-ray school a long time ago. Most you'll find, I'd say, I can't even give a percentage, but there are a large number of ultrasound techs that are also X-ray techs. So in answer to Roy's question, it's a very complementary field. I wouldn't say it's starting from the beginning at all.
It's just adding to your knowledge.
Absolutely.
Did Sam, going through the curriculum of the X-ray program at CAC, and not just the fact that you had that medical sort of field and transitions, but going through that sort of curriculum where everybody's together, it's a cohort that you go through, did that help you the second time around going through the sonography program?
Yeah, just getting used to the whole anatomy of stuff, and having the history of going through X-ray school, I knew more about where things are in the body, and it does complement what I learned in ultrasound. So they do help each other, and plus being in college, you learn that jumping from one thing to another, it's a little easier rather than have a break for 4 years of not going to college and then trying to go back. So
it makes it easier. You know where everything is at the college. So you're listening to CAC Live. We're going to take a short break, and when we come back, we're going to take some more calls. And Joe is inundated with calls. So our number is 480-745-1033, 480-745-1033. When we come back, we're going to talk more with Sam Reed and Dion Winter from the sonography program at Central Arizona College. You're listening to CAC Live on CAClive in the Santan Valley.
Are you experiencing computer problems? Is your computer running slow, bogged down with viruses and spyware? You need a reliable and knowledgeable, trustworthy computer service company. Contact Computers, Networks, and More, located in Santan Valley. Get your computer or laptop running in top condition by a certified technician with 20-plus years experience and beta tester from Microsoft. Computers, Networks, and More provides repairs and solutions to any computer-related issue, whether it's software, installation, troubleshooting, updates, or tune-ups. You can trust Computers, Networks, and More. Contact Jeff Monday through Saturday, 8 a.m. to 7 p.m. to schedule an appointment. We can have you up and running quickly, usually within 48 hours. Located in Santan Valley. Computers, Networks, and More. We're here for you. Contact Jeff at 480-729-8899. That's 480-729-8899. Our family pets are such a big part of our lives. That's why Kelly's Critter Clips of Queen Creek and Sun Lakes has been providing pet grooming services for over 10 years. Your dog's comfort is very important to us, so we take the time to treat your pet with care, love, and professional attention it deserves. We welcome any size and breed and feature shampoo and conditioning, styling, flea and tick dips, ear cleaning, nail trimming, and so many other services that will leave your pet looking good and smelling good and feeling great, all at an affordable price. Located in Queen Creek and Sun Lakes, call now for an appointment, 480-655-5066. Kelly's Critter Clips. When you visit Hill Family Dentistry in Santan Valley, dentist Dr. Tim Hill provides each patient with personalized, gentle care that you deserve. Our entire team is dedicated to providing you and your family with services that will make you smile. With a full range of general, cosmetic, and specialty dentistry services that will keep you and your family smiling. Our commitment to our community is to provide outstanding oral health. Hill Family Dentistry is located on 36359 Gansell Road in Santan Valley, diagonally across from Banner Ironwood Hospital. Evening and weekend appointments available. We accept most insurances and have in-office policies available for non-insured. Contact us today at 480-588-8127. Hill Family Dentistry.
Are you planning on starting a new business in this economy? As a new business, you know you'll need to watch every single dollar. Before you make any decisions on phone service, call Zentrus Communications at 1-877-ZENTRUS. That's 1-877-936-8727.
Listen to CAC Live on KQCK in the Santan Valley. Just a reminder, next week, Dan Bush will be in the studio, and he'll be talking with some of his EIT students and at Central Arizona College. And Dan will be your host next week. I'll be out of town. I'll be in Dallas next week. And then in 2 weeks, I'll return. And then Joe will have a nice run till spring break of a lot of programs. We're lining them up. Frank Mullica will be here on the 31st. To do a show, and then in early February, we had a popular program we did last year, and we're going to do it again. It's College Goals Sunday, which talks about how you get financial aid and all the paperwork that you have to go through. And CAC is part of this program, College Goals Sunday, that helps people navigate all that the financial aid red tape. Today we're visiting with Dion Winter and also Sam Reed from the sonography program at Central Arizona College, and Dion is the new program director, and Sam was a graduate of the first cohort that completed back in August, right? It was when you guys graduated. And Sam, talk about when you do something like this, it's a little different than, say, going and taking your English classes and math classes and going to per semester. You're sort of embedded in this. You're committed to going through with this, and it can be intense.
Yeah. Lots of us, who have a problem with anxiety, the anxiety goes really high.
They check your blood pressure every day in the morning when you come in.
Really. I got to the point where I was even dreaming ultrasound because you have to
Dion's laughing.
The pressure under knowing what you're doing and the pressure of, what you see is what the doctor sees. So if you don't get it, then he doesn't get it, and that it's all on the line here, and it's a lot to think about, you know.
So how is that different than X-ray? Is X-ray that just you take a picture and it is what it is? You don't really have to. You're not really looking for stuff. I mean, how's that different?
I'll let Dion answer that one.
Actually, in X-ray, they have a set protocol, and you'll take the X-ray, and it's either technically correct or technically not correct, and you turn it in, and then the radiologist reads it. In ultrasound, it's live in real time, and so if you don't take the picture correctly, or you miss something and don't photograph the picture, then the radiologist won't see it. So just what Sam was saying is if we don't see it, then we don't take pictures of it, and then the radiologist won't see it, and it doesn't get reported. So it's important that we follow a strict protocol, that we know our anatomy, that we know our pathology, that we understand what the physicians are looking for in the progression and course of disease.
You can see the pressure and really the responsibility, because at times if you're looking for something, you have somebody's life in your hands. If you're looking for something that could be life-threatening or something that needs to be addressed right away. I could see Sam shaking his head. Talk a little bit about the before that, it looks like we got another call, but I want to talk about your real kind of internships and the clinicals that you go through. But Joe, looks like we got a couple more calls.
Bert from Chandler says, so would you not recommend this if you're not looking for some serious stress? I mean, we don't want to mislead people and tell them that it's going to be a crazy thing they're not going to enjoy. I mean,
it's probably different in different settings. Is that what you guys?
Yeah, I wouldn't want to scare people away from it. I'm just saying that's part of the job, is to be super vigilant, and that sometimes stress comes right along with that, you know.
Just like every other job if you're good at it, then there's going to be stress.
Yes. So I wouldn't shy away from it for that. I think you probably want to explore it a little bit more. And then you have another one there?
And then we have Ray Dean from Scottsdale, who said, a little bit off the subject, but wants to know what entertainment events are coming up at CAC. She said, love the Gin Blossoms.
Oh, well, I'll tell you what, you want to check out a pretty cool one. The new Shanghai Circus is coming in next Tuesday night, and actually the show is almost sold out. There were only, I think, 200 tickets or 150 tickets left for that's next Tuesday night. And then the Atlantic Steps, which is the Irish, best way to describe it, the Irish dance group, really neat. I always say, I think Riverdance plus Lord of the Dance, but kind of more folk and from the west coast of Ireland, I believe. They are making, the Atlantic Steps group is making its U.S. theater debut at the Penn Center, which is really cool.
That's
awesome.
awesome.
It's the first time they'll be in a theater in the United States, and it'll be at the Penn Center. And that's coming up at the end of the month. Just check us out at centralaz.edu or look at events at cac.com. Talk a little bit about the clinicals, Sam, that we were talking off the air a little bit, but that's, for lack of a better term, an internship, but you're not getting coffee and answering phones like some internships that people have experienced. There's an expectation there when you're doing this kind of job.
So as you first start out, they'll let you just kind of back shadow, where you're just kind of watching the ultrasound tech and watching what they're doing, but that doesn't last for very long, maybe a couple weeks, and then they get you to scan simple things like, Sam, today we're going to have you scan some gallbladders. So I'll do the most of the scan. I'll let you scan the gallbladder. So we start off little by little, and then eventually we get to a complete abdomen, where I'll be scanning the complete abdomen from the liver to the right kidney to the left kidney, and they work with you, and you'll do the scan, and they'll come back and after you and make sure you got all the right pictures, and they can help you, and there's a lot of one-on-one, and it's just amazing.
Is when you have a student placed in these situations, and this happens pretty quickly into the program, doesn't it?
Yes. Early on in the first semester, we get out there and start on our clinical sites.
What's the hardest part about that? I mean, you're using the technology which you're learning at CAC, but is a difficult part just kind of learning how to deal with patients? I mean, I'm sure you have a variety of types of patients that you have to deal with.
Well, with the ultrasound program, we do need to come from another healthcare field, so it's not really a shock to us. We've been in it. The hard part about it is looking at this gray picture and somebody's telling me that there's a kidney somewhere in there. So that's the hard part.
Is when the students go through the program, tell us a little bit about what are some of the key things that they have to know right away in sonography. I mean, what are some of the first things that you have to teach them?
Basically, you need to teach them directions, meaning what's up, what's down, what's left, what's right, and planes of the body. It's difficult for students a lot of times because they they have to understand things two-dimensionally to visualize them three-dimensionally.
What type of person does it take to be a sonographer? I mean, if you had to have list characteristics, they have to be detail-oriented, it sounds like. They have to be committed. They have to be patient with... what else? If somebody... Because for those listening, it's going to help them kind of decide, do I want to go in this direction?
Absolutely. It would be someone that has a kind of an analytical personality, somebody who wants to know, people who like to know how things tick, how why this happens, or how to take things apart. You would need a good sense of spatial relations. There's a lot of tests out there that you can take to see if you have good spatial relations. You've seen the old box tests where you have the unfolded boxes and then you put it together and you say, does this work? That's another one. Some of the big names in the field from 50 years back, Joan Baker, who was the first president of the ARDMS, agreed with us that those students that are good at video games are actually very good at sonography because they're able to use their hands while they're looking at a screen. And that's what you have to be able to do, is have one hand scanning, one hand on a keyboard, and then look at a screen and have good eye-hand coordination.
Did you play video games a lot, Sam, growing up?
Well, I think yes, the Nintendo and everything, of course.
It's funny because you could make a video game sonography, see if kids are interested in it. Do you enjoy the work, Sam?
Yes, it is very challenging, and it's really cool to see how the body works. And if you put the ultrasound, since everything's live with ultrasound, you see it as it's happening, and so like I'll be scanning some guy's leg, and let's say he has a blood clot. You can see the blood clot just waving in that vein. Like, wow, that's pretty intense.
Do you ever come across something that you think is, they need to address this like now?
Yeah, something like where you can get a torsion where either the ovary can turn, which it shouldn't turn. If it turns, then it blocks off the blood vessels going to that ovary, and that needs to be fixed within hours, or it'll just die if it doesn't get any blood to it. So that's an example of they need to get that taken care of as soon as possible.
Have you come across anything that you've seen where you felt like you've discovered something and you say, hey, I think you guys should take a look at this? I mean, as a doctor, doctors make the calls on it, but do you ever felt like inside, there's something here, and I've made an impact by saving maybe not a life, but at least making somebody more comfortable quickly?
Yeah, being part of the clinical thing, you're part of the story. So in part of one of our clinical sites, we're at the maternal fetal center. So I was doing a scan where part of the placenta became detached from the rest of the uterus, and that's something that needs to be taken care of. And so we had the doctor come in and in that exam. The doctors don't always come in our exams. We do our exams and then send them to the doctor, and they'll take a look. But some cases like that, we need the doctor to take a look and take care of that.
It's what's the hardest thing about your job?
I think it's just you have to remember a lot of details about how organs work, and you're just like a walking dictionary basically with ultrasound. If you get lax on it, then then you're a liability to your patient and yourself, and you're not, like, for me, for example, during my training, I was scanning this lady, her inner thigh, and they wanted to see if there was an abscess, if they had had a big pocket of fluid under there, or if it was just a rash on the skin. I didn't want to cause her too much pain, so I scanned kind of lightly, and then the ultrasound tech that came after me to make sure I got some good pictures, she scanned a little harder. The patient was yelling out of pain, but she got better pictures, and it showed that there was a pocket of fluid. So I was actually doing her a disservice by trying to be gentle and be nice.
That was a question I was going to ask you, is obviously you're dealing with people a lot of times that are in pain or some kind of discomfort. That's got to be a challenge to not, like you said, you need to get it to help them to get the best images possible, but on the flip side, you don't want to cause them any more distress. So how do you find that balance?
It's just from experience. Sometimes if they're just in too much pain, with the hospital situation at least, you can send them back to their room. The doctors and the nurses can give them some sort of pain medication, and then you'll call them back, and they can get through the exam. Is
communication with patients important? Can you say to a patient, look, this might hurt a little bit, but I want to get a good picture. I'm going to push a little harder. You tell me when. Is that really important?
Absolutely. That's a key point in clinical sonography is communicating with your patient, both for history and for if everything's going okay. You constantly throughout the exam check with your patient to make sure that everything's going okay, that you're not just looking at the screen and ignoring the patient.
Is that something you teach in this program? Is that something that's drilled constantly?
Absolutely.
It's you talk about, it seems, when I was young, the beds, I remember I was in the hospital for 8 days, and I was 8 years old, and it was, I remember being an awful experience. Nurses were nasty. Nobody seemed to care. Today you go in and it's a different experience in most places. It's, they try to make everything from the ambiance of the place a little bit better to, they talk to you. They're like, okay, we're going to do this, we're going to do that. That seems to be a fundamental shift in the healthcare field over the years. And is that something that's kind of works its way down to the education part?
Absolutely. Just like you get a better exam from a patient who understands, you also, a student will be better prepared and will learn more if you are patient with them and understand where they're coming from. So,
let's talk a little bit about the program. If somebody wants to get involved, how does it work? Do they go sort of year round for a set amount of months, or is it on semesters, or how does this particular program work?
It's an ongoing 2-year program, and once you begin the program, we start a new class every fall. And when you start the program, it goes for 2 years, and it's full time. Wow!
So it's a commitment. It's a real commitment for it. So, do the classes continue over the summer?
Yes, they do.
So it's a nonstop. Basically, you're in it. You're going to boot camp for 2 years. It sounds like.
Yeah, it's not only boot camp, but it's almost like a 2-year interview, because you're on your clinical rotations, and so you're making your debut out there in the sonography field, and it is a small community. Everybody knows everybody. So we always teach our students, if you don't have nothing nice to say, don't say nothing at all.
Sam, we were talking about the clinicals, and off there you talked about that CAC really has some great opportunities out there. Talk about that, because that was something that you were pretty passionate about.
Yeah, one thing I noticed was at the different hospitals I went to, we would see other. I actually wouldn't see other students from other programs in the Valley, and there's a handful of ultrasound programs and X-ray programs in the Valley. And it seems like CAC kind of has like a monopoly over the best hospitals in the Valley, and it's great. Other schools are actually kind of jealous. And one thing I really like too is that CAC sets up our clinical site for us. They already did the hard work, because I've heard stories about students having to call the ultrasound department, please, let me practice my my internship here because I don't have any place else to go, and I need this experience.
That's almost kind of like, when Joe and I, you're in school and you're trying to set up your own internship at a radio station or something like that. But this kind of thing, it would seem with clinicals, it would almost be better that the institution set it up with the companies, with those medical facilities, as opposed to sending a student out trying to do that.
Absolutely. We have clinical partnerships with medical centers, major medical centers throughout the valley. And they are excellent with sonographers that are, we call clinical instructors, that are very committed to teaching the students and one-on-one.
What's the classroom time versus the clinical time? If you're in this program full-time and you're going through, what is it? Are they in class like 8 hours a day, or how does the class work? Or is it like hour-long classes like a typical college student would take?
Well, basically, first year the students are in class 2 days a week, and then they're in clinicals for 2 days a week, and that would be Monday through Thursday. In the second year, they're in clinical rotations for Monday, Wednesday, and Friday, and they're in class on Tuesday and Thursday. Normally, classes don't go past 3:30 or 4 o'clock, but I can't guarantee schedules in advance.
So it's did you know what you were signing up for in terms of this boot camp when you got into it?
Honestly, I didn't. I thought ultrasound, that'd be cool. I can scan that, or one of these. The first exam I saw when I was in X-ray school of ultrasound was they had this bottle. This guy was sitting on his bed, and there was a bottle behind him, and the doctor. There's the ultrasound tech scanning the guy's back, and the doctor pokes the guy's back with a needle, and there's a tube hooked from that needle to the bottle, and then the bottle starts filling up with fluid. And I was like, I totally want to do that. But there's more to it than just that one exam. There's a lot of different variety.
Do you think the clinicals helped prepare you now that you're out looking for a job? You got the 2 part-time jobs, but as you're going, that must be extremely important.
Definitely, and I think employers lots of times are kind of nervous about taking on a new grad just because there's so many schools out here in the valley that don't give you that much experience, and so they're kind of nervous about, should we take him on? We don't know his background and all that. So it's a little tricky with that.
What do employers look for, Dion? And I mean, obviously you learn the technology side, you learn kind of the academic side, you're doing the clinicals, but when employers are looking, if all things being equal, they have the education background and this experience, what are they looking for when they're then hiring students? Because obviously everybody's got a different personality. Are there other things that they're looking for?
When they first hire a new grad, they're looking for their credentials, that they're RDMS registered, which Sam Reed is. And
explain what that is.
The ARDMS is the National Registry Boards for Ultrasound Technologists. It's gotten to the point where you pretty much can't get a job unless you're registered. All of the students that come to our program are eligible to sit for board examinations upon graduation.
And then does an employer look for, what are some of the intangibles? Are they looking for somebody that's willing to learn, that wants to grow? Are they, what would an employer, are they looking for personality? Are they looking for commitment from that person? I mean, obviously the education part, say everybody learns and they come out of school, but obviously there's ones that get jobs and ones that, that don't.
They're actually looking for people that are not going to stand back and say, "Oh, let somebody else do it," or stand back and say, "Oh, I can't do that," or "I've never done that before." So, in other words, they're looking for people that are ready to jump in with both feet, do things, learn new things. If they don't know them, they're looking for students that are pretty much Motivated, yeah.
Sam, was there a point when you were going through all this, and it could be in the radiology or it could be in the sonography, that you got comfortable? You know, there's that moment when you're learning this stuff and you're kind of figuring, okay, do I touch the equipment? Now I've touched the equipment. Now I'm doing this. Is there a moment you can remember where you just got comfortable and said, yeah, I know how to do this. I'm very comfortable doing it.
I'd have to say yes and no. About the first year mark is when I started to get more comfortable doing complete exams, not just bits and pieces of them. And then for me, the last 6 months I was doing most of the exams by myself with little help.
In your clinicals?
In my clinicals, I'm talking about. But at the same time, the no part of it was about halfway through. I was a nervous wreck, and I was like, how can I finish this program? I'm going crazy because just the whole volume of information that you're going through, you know.
Do you have days where, you know, you see so many of these things and you see different injuries and different medical conditions? Is there something that happens every day or every week? It's like, wow, I never saw that before.
Oh, definitely. Even my teachers that have been working for years, that when they'll see something, they'll say, yeah, I haven't seen that before. Well, they've been scanning for 20, 30 years, and they still say that, you know. And the funny thing is, every patient is different, where they have funny shaped kidneys sometimes, or you know, that their two kidneys might be attached in the middle. That
really
that can happen, and it's different.
What's the strangest thing you've ever seen?
I was going to ask the same thing. A big semi-truck or
somebody swallow something?
Not so much with the ultrasound. I know with the X-ray, I X-rayed a guy with a hook in his hand. That was kind of interesting.
You've been in this a long time. What's the strangest thing you've ever seen?
Probably I was scanning she was actually a 16-year-old girl years ago, and I just started like a normal scan, and things were just not, I couldn't understand. They were just not quite right. All of her organs were reversed, right to left. Her liver was on the left side instead of the right side. And
wow.
That doesn't happen very often when it's complete. She had a complete reversal.
Wow.
That could throw you off.
Like that.
And she was fine, right?
She was perfectly healthy.
Imagine that.
She never knew it.
They better mark her for surgery, huh?
I remember seeing on the news one time, it was there was a young girl. I want to say she was 5 or 6, and I want to say it was in like one of the Scandinavian countries. I don't know if you remember seeing this on the news. Had like a nail that apparently she had swallowed at a very young age and had been in for several years, and they showed it, and it just never knew it. Like, well, she probably knew when she was young, but the parents never knew it. And it was the strangest thing. Does this technology, do vets use this technology now in sonography and for radiology?
I'm glad you asked. As a matter of fact, a couple of students asked me that this morning. Yes, actually, they do use a lot of ultrasound in veterinarian technology. Years ago, I had a couple of vet techs who actually were students in sonography, and they became registered sonographers, and they did end up going back to vet tech. So yes, they use it from anywhere from large animals to, as a matter of fact, I have a picture of them doing a scan on a panda.
It's probably changed the world of veterinary medicine when this technology came in.
Actually, it has, especially in domestic animals like puppies and that kind of thing. You can count the puppies, and they'll know in advance how many they're going to have, like when they're breeding and those kind of things. There's a lot of medical conditions in certain types of breeds of dogs, like Great Danes and things like that you can use ultrasound for. I
have a dog that's a lunatic. I probably couldn't scan for that, though. But I imagine, too, that when you're talking about like livestock and farmers, that this technology probably helps their animals, keeping them healthy and probably less invasive in some of the stuff that they need to treat. It's a fascinating kind of world. I guess it's sort of endless in what direction all this could go. in terms of careers?
It's a very vast field. Once you get into sonography, there's lots of different avenues that you can go.
Well, it's unbelievable, but this hour is blown by, and we want to thank both of you for coming by. Dion, again, Dion Winter, DIONNE.Winter at centralaz.edu. If you're interested in the sonography program, email Dion. She can give you the information. It is at the Superstition Mountain campus up at Apache Junction. And Sam, we wish you the best of luck. I know you're a graduate of Mesa High School and now two-time graduate of CAC in both the Rad Tech and sonography programs, and we wish you the best of luck. So thanks for joining us. Next week, Dan Bush will join you here talking more about the EIT program, and then in 2 weeks I will return from my little trip to Dallas. For Joe Carrero, I'm Tom DiCamillo. Thanks for listening to CAC Live on KQCK in the Santan Valley.
Santan Motorsports, located in Queen Creek, specializes in off-road ATVs, dirt bikes, UTVs, side-by-sides, street bikes, and provides